We win. Welcome, welcome, welcome on this beautiful day. Yes, it's cloudy out, but it is a beautiful day with our revolution on the mall in the shadow of the Capitol. It's a beautiful day because today the Medicare for All Act of 2021 is going to be introduced right behind me. We're so excited that one of the two co-lead sponsors, Congresswoman Debbie Dingell, is with us, and we'll be speaking to her in just a few moments. I'm Hal Ginsberg, East Region Coordinator for our revolution, and I am so proud of this organization and our amazing activists from coast to coast. I want the great people here on the mall and the thousands who are watching on our live stream across the country, in fact, across the world. We've even got chapters in Europe and France, all over the place, in just about every state. I want them to know, I want them to feel proud of the amazing work that has brought us to this moment where we have well over 100 co-sponsors for the Congresswoman Dingell, Congresswoman Jayapal legislation. And of course, women are leading. We'll be hearing from great healthcare providers as well today, but they are in the fight for Medicare for all. They are in it to win it because we deserve it. We need it. What do we want?
Medicare for all.
When do we want it? So we're going to get going in just a moment. Lots of great speakers. And again, it's not just a national fight. It's not just a federal fight. Yes, the best solution, of course, is Medicare for all in the House, in the U.S. Senate. But we're fighting that great fight across the country, in state houses, in California, for CalCare, where our revolution, California, is leading. We are fighting in Maryland, my home state, where our revolution, Maryland, is leading. In fact, Delegate Sheila Ruth, a co-chair of our revolution, Baltimore, has introduced the Commission on Healthcare, which is a legislative bill that will create a commission to determine exactly how to move forward and implement Medicare for all. And it's not just in California. It's not just in Maryland. It's not just in blue states. In Texas, our revolution, Texas, is leading the way with Healthy Texas. So we have lots of paths to get to that. Healthcare is a human right goal that we all are fighting for. We're all standing for. But the first, the most important, the best win, the best battle is the one being led, leading the charge. My first speaker, my first guest, our first speaker, let me welcome Congresswoman Debbie Dingell from Michigan. Let's give it up for Representative Dingell.
When do we want it? Now. What do we want?
Medicare for all.
Do we want it?
Now.
So tell us why you're a healthcare hero. Why are you leading the fight, Congresswoman Dingell, and how's it going?
So how's it going? We're introducing it again today. So that is the most important. But we need to really talk to people about the facts. 30 million Americans do not have health insurance. 40 million Americans cannot afford their co-pays or their medicine. We spend more money per capita on healthcare than any country in the world. And yet, life expectancy is lower, infant mortality rate is higher. We have terrible outcomes. We are the only industrialized nation in the world that does not guarantee every one of its citizens health care. That is immoral. It is not right, and the time is now. I wear my mask. The pandemic, COVID-19, has shined a light on the fractures in our healthcare system. And there's been a disproportionate number of African Americans, people of color, people that are disabled that have died. And why? Because many times they have an underlying health condition and they're not able to go to the doctor to even get the treatment that they need. That is morally wrong. And then in this pandemic, too many people have lost their insurance that's been tied to employment. So they've added to the uninsured numbers. The parents who have sick kids, who are afraid to go to the doctor because they can't afford it. They have to choose between food on the table, a roof over their head, or getting their children the health care they need. Seniors. I went and visited a senior at the beginning of this pandemic, and she said to me, they've already made a decision, I'm disposable. Nobody cares. It's too expensive to take care of us, and they're just going to let us die. That's not the America that I know, and it's not right. Healthcare is a right, and it's time to get it passed in America. I'm going to talk about my husband for a minute, his brain was there every single minute. But in the last 4 years of his life, I saw how broken the healthcare system was. And I'm supposed to be able to navigate systems. He was in the Congress before me, and his father was in the Congress before that. But we run for election every 2 years, and we work hard for the people we represent. His father was one of the authors of Social Security. They called him a communist at the time. They called him a socialist. Does anybody think that anybody in this country would take Social Security away from anybody? No. And the first thing he did after he got Social Security done was to introduce universal health care. This is a fight we've been fighting for almost 100 years. It's time. John Dingell introduced universal health care every year since 1955. Do you know why we got Medicare at all? Because these two men never stopped fighting. And we are not going to stop fighting. The time is now. It's long enough. We have got to make, some people say we're doing too much. We're going too far. I say we're not going far enough. It's time. People should have a right to health care. They shouldn't have to worry whether they can afford to go to the doctor or take their medicine. Please, this is the time to create the momentum to get Medicare for all passed and guarantee every American access to health care. Thank you. And I wanted to now. Medicare for all. Now. And as we introduce it today, I want you to know we have 14 committee chairmen that are among our co-sponsors. Frank Pallone, who's chair of my committee, that's got the main committee on healthcare, came on last night, and he has guaranteed me hearings. So progress. Now let's take it and deliver. Thank you.
When we organize,
we win.
When we organize,
We win. Wow, how great is Congresswoman Dingell? We thank you so much for your leadership and for coming down here from the Hill to speak to us and to the thousands of folks online. By the way, I do want, and I'm so glad that the Congresswoman mentioned Representative Pallone from New Jersey, because one of our great leaders, Anna Martavishki, the New Jersey organizer, she is also a coordinator like me, has led the fight in New Jersey, and she has been knocking on Pallone's door. She has been bird dogging Pallone. She has been calling on Pallone for years. You can go back and Google Vishki and Ballone, and you will see article after article with Anna Marta leading the charge. And we see that hard work, that sweat equity paying off. It can feel lonely out here. Sometimes you knock on doors and people don't respond. But when we organize in the end, we win. Now, let me bring up a friend, an artist, a fellow Marylander. I think he's back there. He is going to be seen coast to coast again this afternoon when he's on the call with Congresswomen Jayapal and Dingell. But right now, we've got him first, Phil Ateto. Phil, where are you? I'm looking around. I know you're here. I saw you before. Phil Ateto, who is going to tell us about his healthcare history and about why he is here, why he is leading the charge, and why Phil's circumstances tell us why we need Medicare for all. I see Phil's got a, are you good, Phil? Come on up. Okay, we'll bring Phil right up here.
When do we want it?
Mental health care are significant contributors. Currently, in most states, pregnant women are allowed to enroll in insurance, generally Medicaid, when they become pregnant, regardless of other financial and legal barriers. However, it can take the entire first trimester for enrollment and therefore full prenatal care to start, and that coverage is dropped within 8 weeks after delivery by most state laws. This means that many moms, especially poor, Black, and Brown women, do not get treated for chronic conditions that impact maternal health and mortality, like diabetes, high blood pressure, obesity, depression, and anxiety, unless they are pregnant. This lack of preventative care increases the possibility of death and disability when they are pregnant. This also is not right. As a pregnant woman myself, I understand firsthand the importance of early and reliable access to prenatal care. I am fortunate. For now, I am covered. However, tens of millions of American women are not. And again, that is not right. The Medicare for All Act of 2021 guarantees uninterrupted health care across the lifespan, regardless of employment or financial status. With Medicare for all, we would all be healthier physically and emotionally, and most of us would even be financially wealthier. As Representative Dingell said, every other industrialized nation in the world provides universal health care for their citizens at a fraction of the cost of what we currently spend for inadequate care. We must follow suit. As a medical doctor, my prescription for our nation is universal health care. We can and we will continue the fight to bring affordable, accessible health care to all. Let's say it together. Healthcare is a human right. Thank you.
What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
Congress, hear you. What do we want?
Medicare for all.
When do we want it?
Now. All right. Thank you so much, Dr. Laura Kaplan Wiseman. And I'm sort of misting up to be here with such great people and friends and allies in this movement to guarantee healthcare as a human right. Next up is Chrissy Holt from Annapolis. And Chrissy and her son do suffer from a congenital condition, which points out the need for Medicare for all. Chrissy, if you can come up and tell us a little bit about why you are a healthcare hero.
Hi, my name is Chrissy Holt, and I'm from Annapolis, Maryland. And over 25 years ago, my son was born uninsurable with severe hemophilia A. It's a genetic bleeding disorder. So every other day, we have to set up an IV and give him a medication to help clot his blood. It costs $1,000 a dose every other day. Our bills are $30,000 a month. In a good year, when my son's not bleeding, we spend over $360,000 a year in health insurance. There are over 400 hemophiliacs in the state of Maryland. If we don't get our treatment, we don't die, we get more expensive. We go to hospitals, we get joint bleeds, we get soft tissue bleeds, we miss school, we miss work. When you give us the medication, We are healthy citizens in America. My son is about to graduate from graduate school. He's an honor student from University of Maryland. We decided to let him go to University of Texas, Austin, and get a master's degree in economics. He will graduate in May, and at the same time, he will fall off my health insurance. What does a 26-year-old do? What are his choices? He will try to get a job, of course, but will he get health care? There's no guarantee. A lot of this younger generation doesn't get access to health care because they can't get the hours at work. He could go on the Maryland Exchange and pay $500 a month, but he doesn't have a job yet. So how does he do that? I could pay Cobra for him for the Federal Blue Cross Blue Shield, the gold standard healthcare plan. It's $800 a month in Cobra. He could go on Medicaid. On Medicaid, we work to get that expanded so that childless men, childless women with chronic illnesses could go on Medicaid. But to do that, you have to take a vow to poverty. You have to decide you're going to work for less than $17,000 a year. So at the Maryland minimum wage of $11 an hour, he could work full-time in January, but he would have to stop working in October to be able to get access to his medication. This is the system we have built to either force poverty or to make the chronically ill go without. It is a crime against humanity. I have been an advocate for equitable health care for over 20 years with the Hemophilia Foundation. We have fought for clean blood supply, for no lifetime caps, for access to the care that we need. The ACA wasn't enough because because we have to spend so much money. We fight constantly. We have been traumatized by insurance companies year over year. Just this year, End Medical Debt is a bill that we're fighting in the state of Maryland. Hospitals are saying that they have to be able to sue sick patients for less than $1,000. They want to lower the bar. Delegate Body Costa wants to lower the bar to $500. The hospitals have to be able to sue sick people for less than $500. The healthcare companies are fighting us for copay accumulators, meaning we can pay for our copays, but they won't accumulate. We're constantly traumatized by the greed of insurance companies. It is past time for Medicare for all. Let's not traumatize another generation. Let's give our people what they need, which is access to healthcare to save their lives. Thank you.
Hey! Ho, ho! Corporate greed has got to go!
Hey, hey! Ho, ho! Corporate greed has got to go. Hey, hey! Ho, ho! Corporate greed has got to go. Hey, hey! Ho, ho! Thank you so much, Chrissy. And we're going to let Chrissy and Phil go because they got to get ready for the press conference at noon. And we do hope you will watch that because we will hear all the particulars about the bill from the great congresswomen who are leading the way. And it is no surprise that women are leading because the healthcare system, although it fails all of us, it fails us in different and inequitable ways, with women and people of color getting the brunt of the harm, with them suffering more because of the high cost of healthcare and the skewed nature of its delivery. We are in the nation's capital. When people think of Washington, D.C., they think of the federal government. They think of the big building behind us. They think of the Washington Monument in front of us. But Washington, D.C. is a city where hundreds of thousands of people live. And leading the charge in the nation's capital for healthcare, for the residents here and across the country, is an organization called DC Spaces in Action. It's my honor now to welcome Terrence James from DC Spaces in Action. Terrence, if you want to come up and tell us about your group and what you're doing to fight for Medicare for all.
Thank you, everyone. Thank you. Like you said, my name is Terrence. And Spaces in Action is a grassroots organization that focuses on low-income families within DC who are impacted by social and economic injustice. Together, we take a seat at the table to develop community-centered solutions and step into our power. We help people step into their power through leadership, training, grassroots organizing, and by creating a safe space for people to learn and grow. First off, I would like to say that the day has come that we have all been waiting for. The introduction of the bill that will save many lives and help many people fighting the hospital as we speak. About unpaid medical bills and having to choose between providing food for their families and paying off some medical expenses. I'm a health justice organizer with Spaces in Action and also an affiliate of CPD. I have been involved with conversations around M4A resolution in DC to help support the federal level bill being introduced today. The M4A resolution has already passed in many other cities, so we can't wait until we get this done in DC as well. That is why I have been meeting with city council members via Zoom to have conversations about the current healthcare crisis and the need for Medicare for all. We must continue to fight for what we know is right. If that consists of bird dogging, Twitter storming, Instagram, making hashtags, engaging with the community for public knowledge to make sure that we're all on the same page. To change history and support Jaya Paul and Debbie Dingle introducing the Medicare for All Act of 2021. Thank you, everyone.
All right. Thank you so much, Terrence James. Thank you so much, DC Spaces in Action and CPD Center for Popular Democracy for leading with us at our revolution to bring healthcare as a human right across this land and in all of the states and the District of Columbia. So now our next speaker is going to be a mayor. We talk about different types of governments. Now we will welcome Greenbelt Mayor Colin Bird. He is also a member of Mayors for Medicare for All. And in his county, Prince George's County, they are now leading the way, pushing for our revolution, Prince George's, and other organizations pushing for a resolution in support of Medicare for all. So now let me welcome Colin Bird. Mayor Bird, if you could come on up and tell us a little bit about your community and why it deserves Medicare for all.
First of all, can y'all hear me?
Yeah.
Good?
Yeah.
All right. First of all, let me just say, brothers and sisters, thank you. Thank you, Mr. Ginsburg. Thank you for the invitation and thank you for the warm introduction. I'm really grateful for that, number one. I'm so glad to see all of the members of Our Revolution Maryland and so many other partners out here standing for healthcare as a human right. Brothers and sisters, as Mr. Ginsburg noted, I am a mayor. I'm the mayor of Greenbelt, Maryland, which is in Prince George's County. And there's so many things I could say about gorgeous Prince George's County, but what I want to highlight here is that Prince George's County, before the pandemic, because a lot of people thought healthcare crisis in America started in the pandemic. Prince George's County, before the pandemic, was and is the diabetes capital of these United States of America. The diabetes capital of these United States of America. And so when some of the previous speakers spoke to how in the coronavirus pandemic, those with pre-existing conditions have been hurt the most and hit the hardest, Prince George's County within the state of Maryland has been ground zero for the worst of this pandemic. And yet at the same time, we've seen pre-existing inequities be exacerbated in this pandemic, from vaccine distribution to healthcare delivery and so much more. And so we are living in dark times. And because we are living in dark times more than ever, now we are sick and tired of being sick and tired.
That's right.
11 years ago, the 44th president of these United States of America, signed the Patient Protection and Affordable Care Act into law. This momentous legislation purported to protect those with pre-existing conditions and expanded coverage to more than 20 million Americans, cutting the uninsured rate from 17.8% in 2010 to 10.9% in 2019. Note what I did not say. I did not say to 0%. 11 years later, America still has a broken healthcare system. Between January and June of 2020, 30 million Americans were documented as uninsured. And as I indicated, the coronavirus pandemic has only exacerbated this problem, with millions more losing insurance because they lost their jobs. About a week ago, the president, the 46th president of these United States of America, signed a bill into law that covered a range of issues, including strengthening and expanding the Affordable Care Act. But while the American Rescue Plan substantially lowers costs for those who lost their jobs and for those who bought their coverage on a government exchange, these changes are only temporary. The subsidies for people who buy their coverage on a government exchange, those subsidies expire at the end of 2022. Subsidy for those who lost their jobs, the COBRA subsidy, will expire at the end of this September. And even with these temporary changes, millions of Americans remain uninsured. And so, with the American Rescue Plan, yes, help is on the way, but not enough. We need more. And we deserve more. We deserve more than a healthcare solution that is here today and gone tomorrow. And we deserve better than a healthcare system that leaves out so many of our fellow Americans. What we deserve is Medicare for all. Universal health care doesn't just mean you only deserve health care if you're a billionaire. It doesn't just mean you only deserve health care if you're a millionaire. It doesn't just mean you only deserve health care if you make six figures. It doesn't just mean you only deserve health care if you have a job. It means health care is a human right. It means your humanity alone should guarantee that you won't be plunged into financial ruin, that you won't be plunged into poverty simply because you get sick or because you get injured. But while the coronavirus pandemic has made the rationale for Medicare for all as plain and clear as ever before to champions like Congresswoman Debbie Dingell, to champions like Pramila Jayapal, to champions like Congresswoman Alexandria Ocasio-Cortez, who have been leading on this issue for years, we still have politicians who are beholden to lobbyists who vehemently oppose Medicare for all. We still have politicians who are beholden to corporations who vehemently oppose Medicare for all. While Congressman Anthony Brown supports Medicare for all, Congressman Hoyer has yet to announce support for Medicare for all. While Congressman Jamie Raskin supports Medicare for all, Congressman David Trone has yet to support Medicare for all. While Congressman Sarbanes supports Medicare for all, Congressman Dutch Ruppersberger has yet to announce support for Medicare for all. While the late, great Congressman Elijah Cummings supported Medicare for all, Congressman Kwesi Mfume has yet to support Medicare for all. While champion Senator Bernie Sanders supports Medicare for all, Senator Ben Cardin has yet to announce support for Medicare for all. And while Senator Ed Markey supports Medicare for all, we have yet to hear the same support from Senator Van Hollen on Medicare for all. Now, why is this? Well, I talked about corporations. I talked about lobbyists. But there are those who will say, well, how do you pay for it? How do you pay for Medicare for all? You're trying to raise taxes. Yes, but what they don't tell you is whose taxes get raised and whose taxes get lowered. For ordinary Americans, under the right Medicare for all system, ordinary Americans would pay less in taxes. But folks like Jeff Bezos folks like the Warden family would pay more. In these United States of America, God forbid Jeff Bezos pay a little more. So you hear that. You hear taxes. You also hear Medicare for all is socialism. Now, before we get into a long debate about socialism, have you ever noticed that every time there's a crisis when there's no crisis in America, socialism is terrible. But every time there's a crisis in America, they like to give a little taste of socialism, don't they? They like to give a little taste of socialism. What we need is to stop getting samples of socialism, and what we need is a permanent solution, not only to healthcare problems in America, but to so many of the other problems that within a crisis, we put a Band-Aid on the problem instead of fixing it for the long term. And with respect to the cost of Medicare for all, the cost of Medicare for all pale. They pale in comparison to the cost of the status quo. Let's talk about the cost of the status quo. The cost of the status quo are ordinary Americans financing and subsidizing the bloated profits of drug companies, financing and subsidizing the bloated profits of insurance companies. The cost of the status quo are high premiums. The cost of the status quo are high co-payments. The cost of the status quo are high deductibles. The cost of the status quo are high out-of-pocket expenses. The cost of the status quo, as we've heard earlier, are prescription drug prices that are through the roof. The cost of the status quo is 30 million uninsured plus. The costs of the status quo are unacceptable. We do not want the status quo. What do we want? When do we want it? What do we want? When do we want it? What do we want? When do we want it? We don't want a Band-Aid. Thank you, ladies and gentlemen.
All right, that was just great. Great for me to meet Colin Bird, mayor of Greenbelt. We have talked before. It was really exhilarating to see and hear Mayor Bird, and we're going to hear a lot more from him and about him in the future. So we are one of the organizations, we like to see ourselves as the leading organization. We have thousands of people watching this video across the country, but we're certainly not doing it alone. Now I want to welcome a leader in the DMV, that's the District, Maryland, and Virginia, Abel Amene. He is leading the healthcare team at Metro DSA. Abel, thank you so much for joining us. Please come on up and speak to us about your group and what you are doing.
Thank you very much, everyone. My name is Abel Mene. I'm an organizer with Metro DC DSA and our Medicare for All working group there. We believe in this bill so much, we created a working group just to work on it because this bill is so important. But one thing we've realized is that Medicare for All is an overwhelmingly popular legislation across the political spectrum. It doesn't take socialists like me. Everyone believes in it. That's what we've seen. The only people that are standing in our way are some of the people that work in that building right there. That's right. So why is it that they continue to fight against Medicare for All? Well, we know it's because the profiteers in the for-profit healthcare industry are funding their reelection. That is why. So we need to think strategically about this. So one of the things we're doing is going city by city and county by county and passing local resolutions in councils in every state, in every city, in every county, to show that the people want Medicare for all. And we're doing this everywhere, in every state. We don't care if it's a blue state. We don't care if it's a red state. We're going to do it. We're doing it in New Orleans, Louisiana. We got it there. We've done it in Knoxville, Tennessee. We're going to do it in every city, in every county. And in this city, we are also going county by county. We're doing it in Maryland. In PG, they introduced the bill just yesterday. Delegate Denny Tavares introduced the bill just yesterday and already has a majority of co-sponsors on that council. And we're going to introduce a bill in the DC Council in the Wilson Building as well. And we're going to get that passed as well. And we want your help to do that. We want you to go to Northern Virginia and do it. We want you to go to Montgomery County and do it. We want you to go to Baltimore and do it. We want you to go to every city and every county and pass resolutions, because these people need to know we are behind Medicare for all. So thank you very much. Join a coalition near us. Many of you, I already know, are part of these coalitions. There's the Maryland Progressive Healthcare Coalition. We have a coalition right here in DC where Spaces in Action is a member, and we have Public Citizen, and then you, some of the, hopefully even Our Revolution will join us, and we will be fighting for this. So thank you very much for letting me speak. And let's fight for somebody we do not know. Thank you very much.
We're gonna just keep going. We'll speak to that gentleman in just a moment. We are here in the shadow of the Capitol. We've got a few more speakers. I do want to thank so much Abel for telling us about the efforts that DSA is making in conjunction, in alignment with us, to pass Medicare for all. Our next speaker, Walla Blagay, is a lawyer. But don't boo, don't hiss. I'm a lawyer too. My boss, Joseph, is a lawyer. Walla represents working people. She represents folks who are fighting themselves for healthcare, who need it, who desire it. Walla also is one of the founders of Our Revolution Maryland, the organization where I first became part of this great group of leaders and activists in the fight for social and economic justice. Welcome, Walla Blagay. Thank you so much for being part of this event.
All right.
What do we want?
Medicare for all.
When do we want it? I'm proud to be here today because I have been supporting Medicare for all, any part of a single payer program, but Medicare for all for a very long time. I am a supporter of Medicare for all because I was one of those who was a victim of this system that we have in the United States. I went to a doctor when I had an allergic reaction when I was in college. I went to an emergency room at Washington Hospital and was told that I actually had a $3,000 bill and was told that I was no longer under Medicaid because I was over 18. And because of that, we owed $3,000. My parents don't have $3,000. I came from immigrant parents who had nothing, no savings. We had no money, and I cried and was stressed out. And after that, I had to actually fight to get that $3,000 off my credit. And that was a lesson for me. After that, I got up and said, what can we do to change this system? So that's why I'm standing here today, because I know what it feels like when you get that bill and you cannot pay it and you do not know what to do. And my parents were stressed out. How are we going to pay this bill when we don't even have enough money for rent? Many of Americans are just like me at 19 years old, stressing about a medical bill. This is what we put our local residents through in United States, and it's despicable. So now I'm also an advocate because I am a lawyer and an advocate for working people. Last year, I had to sit with a nurse
who was 60 years old, about to get laid off. And she says, well, can you explain how I'm going to keep my health care with my job? I'm like, no, actually, you're going to lose your health care. And she was like, well, maybe I can get Medicare. And I had to explain to her, no, there's no Medicare. You're not 65. So then she says, well, how am I going to get Medicare? How am I going to get medical support when I have all of these chronic illnesses? And you know what I had to tell her? I don't know. I had no answer for her, because when we looked at the COBRA letter that they had given to me, her payment was almost $1,000 per month. And she had someone else in her home that she wanted to support too, one of her sons. And then she was going to have to worry about how she was going to cover healthcare for him. This is a woman that came from 1970 until now. She was supporting our healthcare system, a nurse, caring for others. And now at 60 years old, we're telling her, you're going to have to pay $1,000 a month to get coverage of healthcare until you're 65. It's despicable. I am an advocate for healthcare because I represent nurses. And when I represent my nurses, they are actually here advocating for so many. Some of our nurses are saying that a lot of times they have people that don't have healthcare and they don't know whether they can schedule a next appointment for them because it won't be covered. So the person's not coming back. So they are healthcare advocates. How are they going to help improve the healthcare of those that that can't come back because they can't afford it? I am also an advocate for Medicare for all because I am running for Prince George's County Council District 6. And thank you. And as a candidate, I've watched many, and I ran before, many people in my neighborhood, my neighbors are reaching out to me because they've lost their jobs. They were contractors, they were working for different things, they've lost their jobs. And they want to know, will they cut me off from my health care? Am I supposed to get government health care? Am I supposed to get something? So we have to go through the process of trying to see whether they can get a health care. If they got a job, as Christy said, you make over a certain amount, you can't get Medicaid. So you got to quit your job. How are you gonna pay your bills? But you got health care. This system doesn't make sense. What do we want? Medicare. When do we want it? Now. It is time that we stop punishing our citizens, punishing them for being sick. That's what happens. Because if you have a doctor, and another thing, as an advocate, we also have people who lose their jobs, they get another job, but they switch jobs. They got to switch doctors. They got to switch everything because now the other job has one healthcare, the other job has another, and they can't use that doctor. I've had to negotiate contracts where I have to say, sorry, you don't have Blue Cross Blue Shield. You now have to have Kaiser. The person says, well, I have this disease and I have this doctor that helps me with my medical care. I need to be with this doctor. And I have to say, no, I'm sorry. You can't do that because you got Kaiser. You got to go to Kaiser. So our jobs determine our health care. Make it make sense. It doesn't make sense. We are punishing our citizens for being sick. The only way that you can live comfortably is if you have a really good job. And even if you have a really good job, you've got co-pays here, you've got this there. And if you get sick, you get older, you have another thing that you have to pay for. So people have to literally say, sometimes you're gonna have to set up a savings account just because if you get sick, you might have to pay thousands of dollars that you don't have. Enough is enough. It's time for Medicare for all. Thank you.
Thank you so much, Walla Blagay. We're so honored that Walla came, and so many great speakers here. And the sun is coming out. The sun knows that the Medicare for All Act of 2021 is soon to be on the House floor. We have got to keep the pressure on. You have heard other great activists throughout this morning telling us this is no time to rest. We cannot bask in the rays. We must continue to pressure Washington. We must continue to pressure our representatives, even if they're co-sponsors. Make sure they're loud and proud co-sponsors. If they're not co-sponsors, call email, text, write. Our revolution will provide many different ways for you to keep the pressure on. Please stay involved. We deserve it. You heard Walla. Working people need it. People of color need it. Women need it. Even upper middle class people would be better off if we had Medicare for all. We must fight for. We deserve it. It's a human right. What do we want? When do we want it? We are going to finish off our program with two labor leaders. It is very appropriate that they follow Walla Blagay, an attorney for working people. Let me first welcome Matt Biggs. I think I'm going to get it right. Matt is the International Federation of Professional and Technical Engineers. So Matt Biggs, are you still here? Here he is. I'm sorry. Welcome, Matt. Thanks for joining us.
Thank you. Thanks for having me, Hal. I appreciate it. Yeah, I'm the Secretary, Treasurer, and Legislative Director for IFPTE. We're an AFL-CIO affiliated labor union. We're also a part of the Labor Campaign for Single Payer, which is a coalition of unions like IFPTE that support single payer and Medicare for all. And we've been together for many, many years, and we've been pushing within the labor movement and up here on Capitol Hill for single payer health care for everybody in this country. Our current healthcare system, as we all know, is failing everybody in this country. It's failing working families. I'll give you an example or two of how this works. When we go to the bargaining table to bargain contracts, and unions bargain contracts with some of the biggest and most powerful corporations in the world, we sit down at that bargaining table and inevitably we sacrifice wages just to maintain or even prevent huge cuts to our health care. And our current healthcare system is suppressing the wages of American working families. And that has to stop. And until we get a single payer Medicare for all system, that will continue. Working people will continue to sacrifice wages just to maintain their health care. And I will say many of the unions in this country, like IFPTE, we also represent workers in Canada. Our union represents thousands of workers in Canada. In fact, this lapel pin I have here is from our biggest union up in Canada. When we go to the bargaining table in Canada, where there is a national healthcare system, we don't have this problem of sacrificing wages just to maintain healthcare. It's a beautiful thing, right? The healthcare system in Canada is great, and it covers everybody. And no one would ever touch that healthcare system, right? So if you look at Canada, wages aren't being suppressed. So a single payer system from labor's perspective is not only good for American workers, it's also good for business. Really, I don't understand why the Chamber of Commerce doesn't support it. It's great for business because as a union that negotiates contracts with corporations, we do realize healthcare expenses is one of the biggest expenses aside from wages that businesses have. So a single payer system is not only good for workers, it's also good for business, for small business. And I'll also say this, just historically, some 80 years ago, FDR had a second Bill of Rights. He had a second Bill of Rights. And in that second Bill of Rights, he called for universal health care. And he urged labor unions, to go out and fight for that. And he also warned against the lobby of the healthcare industry and the pharmaceutical industry. At that time, he said they were spending $1 million. Can you imagine $1 million? It seems like it's nothing today compared to what they spent. But $1 million to prevent us from getting a universal healthcare system in this country. And today, almost 80 years, I think it was 76 years ago, almost 80 years later, we're still standing here in this exact situation where the healthcare industry and the pharmaceutical industry spends hundreds of millions of dollars on lobbying, campaign contributions, and advertising to prevent us from getting a single payer system. We just, all of us together need to continue to fight. We need to continue to beat back the pharmaceutical industry that wants to maintain this immoral system, healthcare system that doesn't work, but it's very profitable for them. So we just need to continue to fight back on that. And on behalf of the Labor Campaign for Single Payer and IFPT, my union, we're going to continue to do that. Thank you.
All right. Matt said he appreciated it. I appreciate him. I appreciate all the working people who are fighting to make life just a little fairer, a little juster for all of us. And now we are coming towards the end of the program. Again, it is starting to get nicer, nicer. The skies are turning blue. That is certainly an augur of things to come. We have one more speaker, Bob Kingsley. I believe he is with the Electricians UE. Is that correct? Bob, come on up and tell us about your organization and what you're doing to make life better here.
Good morning.
Good morning.
It's finally beginning to warm up a little bit. Maybe if we keep raising the temperature, we can warm things up enough up on Capitol Hill that they finally do the right thing. Brothers and sisters, I bring you greetings from a hard-fighting American union, the United Electrical, Radio, and Machine Workers of America, and from tens of thousands of UE members who live and work and struggle for justice in communities and workplaces all around these United States, from California to Connecticut. UE is here today to stand up with our friends in Congress and our allies in our revolution to say it's time for Medicare for all, to say it's time for health care for all the people. It's time to put people before profits, and it's time to make health care a human right. For too long, my union has gone to the bargaining table to find that the boss's first priority is to pick our pockets, to pad the profits of the private health insurance industry. For too long, my union and its members have been asked to sacrifice wage hikes in order to cover the ever-escalating costs of private health insurance premiums. For too long, we have had to deal with the threat of insurance cutoffs as a bullying tactic used against us in strikes and lockouts. Well, we say enough is enough, and the time for change is now. Brothers and sisters, the time for change, in fact, is long overdue. But if you want to finally get healthcare off the bargaining table, the answer is Medicare for all. If you think it's wrong that private health insurance companies have doubled their profits during the course of this pandemic, the answer is Medicare for all. If you believe that we need an issue today that can unite a divided working class in the United States of America, the answer is Medicare for all. My union, UE, is prepared to work in congressional districts all across this country to educate, agitate, and organize to build support for the Medicare for All Act of 2021. Together with our friends in Congress and our allies in our revolution, we believe we can make real progress on the legislative front in the 117th Congress. Together, we think we can get the job done. Let's make it happen. Thank you very much. What do we want? When do we want it?
Thank you so much, Bob Kingsley from the United Electrical Workers. I call them electricians, not the same thing. Thank you so much, Bob Kingsley. Bob's our last speaker. I do want to give a shout out to the artist who designed these amazing visuals, this awesome Medicare for All map, and our sign, Cesar. Cesar is here. Thank you so much, Cesar, for this amazing work that you have done. What do we want? When do we want it? What do we want? When do we want it? I'm Hal Ginsberg.